Today our guest is Will Blank, Administrator of the Washington Rehabilitation and Nursing Center. Thanks for being our guest today, Will.
It's my pleasure to be here. Thanks, Paul. Well, we're a 180-bed skilled nursing facility. We actually have room for about 175 residents. And along with that, we've got a little over 200 employees and sit on a pretty large campus here right in downtown Chipley. Just kind of happy to provide the services that we can for our residents. At any given time, about 10% of our folks are short-term rehabilitation care. So they come to our center, get rehab through our therapy program, and then return to their home in the community. And the other 90% of our residents are there for long-term care. So they're going to be staying with us, indefinitely.
I was totally amazed, number one, at the number of employees. You've got to be in the top 3 or 4 or 5 employers in Washington County.
Right. I think we're pretty strong in the county. And what a lot of people don't realize are the services that we provide. So, we talked a little bit about rehab to home. So we've got anywhere from 7 to 10 therapists working in the building. Of course, we've got administrative staff. We have direct care CNAs and nurses, and that accounts for 150 of our 200 or so employees. We do on-site laundry, on-site food preparation. So there's on-site maintenance. So there's a lot of different facets to our operation.
You've got a very good-looking facility. It's obviously a heritage facility, been there for quite a number of years.
It has.
How long has that building been there?
I think it was constructed in the 50s, the first portion of it. Our building is kind of like 2 blocks added onto each other, and the first was done around the 50s, the second was done about 15, 20 years later, added onto it. So.
Now, who is the parent company of Washington?
Sure, we're part of a large corporation called Signature Healthcare. Signature has 65 nursing homes throughout about 5 or 6 states and a little over 10,000 employees. So we're part of a large corporation. That adds some things to us that we wouldn't have naturally. The big one is what we like to call institutional knowledge. So there's someone that something can learn in a nursing home in Miami that we haven't experienced up here in the Panhandle yet, but because they experienced that, they can share that knowledge with us, and vice versa, we can share our knowledge with them.